Okay, Avanel, what do we say before we start? How do we always start the lectures? Anyone?
Let learning begin.
Yeah, we do. Thanks, Laverne. Okay, so again, I'm going to kind of look at your list as I go through this. And remember, this is a anatomical position. This model or this photo is an anatomical position. Note the thumbs are pointed out. And always the radius bone is on the thumb side. Ulna is on the pinky side. So here's some muscles. This one you can hardly see because it's a anterior view, but the temporalis, it's right over the temporal bone of the cranium, right? So that makes sense. And there's two of them. Of course, these are paired, which means they're on both sides. There's another muscle you're going to need to know called the masseter. It's a big muscle of the jaw. So those are the big head ones. And there's also a around the eyes, very easy, like the orbicularis oculi, make your eyes squint. So orbicularis oculi. So get the spelling down. And there's a similar one around the mouth called the orbicularis oris. So the second name gives you where it is, like oculi means eye, and oris means oral cavity in the mouth. So orb means round. I don't know what curbicularis means, but it kind of makes sense. So those are the muscles of the head. There's one I always put on, like this big muscle here called the SCM, sternocleidomastoid. And it's kind of named after what it attaches to. And I'll explain what origins, insertions, and actions are a little bit later. And there's this weird muscle called platysma. You don't see it on here. I'll show it to you in the APR. Big muscle like the deltoid is a key, that shoulder muscle right there. And all of these are paired so far, except for the platysma. It's kind of like just on in the middle. And then you have the arm, which means brachial. So you have the biceps brachii and the triceps brachii are important. So we'll take a closer look at those. The forearm, the only muscle you need to know the forearm for this lab is the brachioradialis. And we'll show you look at close-ups of that. And the chest muscles, like behind me, the big pectoralis major, which is superficial. Like you'd have to take the pectoralis major out to see the pectoralis minor. And I'll show you that in a close-up later. You can't really see it like this. I mean, yeah, if I asked you here, you could say that's pec minor, but I'm not going to do that because we'll look at the sections in the APR. Then you have intercostal muscles, which we'll look at on a close-up, which means in between the ribs. So the intercostals, the internal and external intercostals. Again, they're not showing you both of them, just saying intercostals, but there's internal and external on your list, and I'll show you what that means. And your abdominal muscles, like your rectus abdominis, are these square muscles or rectangular muscles, sorry. A lot of muscles are named after their shape. Notice that in this picture, his left side is deeper than the right side. They're deeper muscles because they dissected some of the superficial muscles out. So you can see muscles like that are behind, which later on when it's posterior, you see a little bit more. Like the pec minor, you can see better here. And then also in the abdominal muscles, you have the oblique muscles. There's external oblique and internal oblique. And I'll show you the differences there. And even deeper is a muscle called the transversus abdominis. So you have the rectus abdominis in the middle, then you have the external oblique, internal oblique, and the deepest transversus abdominis. So really that's it for your anterior muscles. And I'm just going by your muscle list. So it's pretty straightforward as far as the muscles, and it's a lot less than the bones I'm seeing. So in the back, you have this posterior view, still an anatomical position. You have this trapezoid shaped muscle called the trapezius, right? And then here's the latissimus dorsi. It's like this cape-like muscle back here. So we'll look at that in APR. Large muscle of the buttocks is called the gluteus maximus. Gluteus medius is on top and below it. It's not on your list. Okay. Also, we didn't do the legs in the anterior, so I'll go back, but the posterior one's a little bit harder. So below the buttocks, you have the hamstrings, and the most lateral and the largest of the hamstrings is the biceps femoris. So that's this big one right here. And that's paired. Semitendinosus and semimembranosus. Oh, I'm sorry, let me just go back to the quadriceps. In the lower thigh, now back to anterior, there's a muscle that is very small and it's not too functional. It's called the sartorius, which comes down across. It's called sartorius because it looks like a tape measure. They used to call it the tailor's muscle because it looked like the tape measure they used to measure you for clothes fittings. So it's not really functional. The quadriceps, and there's only three you're going to see, like rectus femoris is an anterior quadricep. Remember, biceps femoris is a hamstring muscle. So rectus femoris is the big anterior quadricep muscle that pretty much forms the patellar tendon that attaches to the kneecap, which is the patella. And then you have the vastus lateralis is a quadricep on the outside, and vastus medialis is on the inside. So that is three muscles of the quadriceps. And there's four of them. There's a vastus intermedius, but you don't see it on these models. And you don't have to know, it's not on your list, but it is deeper and less functional. So the ones you need to know of the anterior thigh, the quadriceps, let me just put quads here. The quads, anterior thigh, front of the thigh, leg extension, is the rectus femoris, the vastus lateralis, and vastus medialis. Now I will do the lower leg anterior while we're here. The only one you need to know is the tibialis anterior, and that is just next to the tibia, just lateral to it, you see? So right here is the tibialis anterior. And in the back, the posterior thigh, you have the two calf muscles, posterior. There's two of them, but they have the same name. It's called gastrocnemius. It just has two heads. And behind it, deep to the gastrocnemius, is the soleus, which is not on your list. Now, the adductors, let me see if they're on the anterior view. The adductors, the most, and this brings your legs together. That's the action. And that's gracilis is the most medial. There's adductor longus, which you can see is more anterior right here. And we'll go through the APR with you. And there's an adductor magnus, which you see more from the back. So let's see what's on your list. You have, yeah, all of those, and pectineus. So I have the medial thigh muscles, the adductor magnus, the gracilis, the adductor longus, and pectineus. Okay, so pectineus is right here. This is a tough area. I'll go into APR with you, and I'm gonna have to record that because this will be really helpful. And basically that's it for those muscles on your list. I just want to go through some information about muscles. And I could ask you this, but really the first thing you have to do is identify the muscle. Like, what is the name of the muscle, and get the spelling as best as you can. So identify it. And then you should know the action. Like, again, well, I'm not going to test you on this. You might get some of this in lecture if you haven't already. The action is what it does. Like if you come up here, you see something like right here. This is dorsiflexion of the foot. This is plantar flexion of the foot. So this is an action of like pressing down on a gas pedal. And the muscle of the calf, the gastrocnemius, does plantar flexion. That's the action. So the action is usually the first thing you should know of a muscle. I think that's the most helpful way. Like if you go into like medicine, or if you go into physical therapy or anything where you're gonna have to learn more involved with the muscles, I always suggest know the action first. The next thing you wanna know is the origin of the muscle. And that is usually the non-movable bone or the fixed part. So in the case of the gastrocnemius, the non-moving bone is most likely to be the top of the tibia, or proximal tibia, or the bottom of the femur, right? So that's not the moving part. Now, the moving part is called insertion. So that's the movable bone. And again, you don't have to memorize these. This is a whole nother class. You'd have to do this. I just need you to have the definitions. So the movable bone, like say you're flexing your biceps brachii, which is up in your arm. You know, you're doing arm flexion. Let me see if I can get a picture for you. Arm flexion. So there's leg flexion on the picture to your left. Let me see if it gets arm flexion. No, it's not going to be arm flexion. So this is flexion of the knee. So the heel is coming up to the butt. So the hamstring muscles do that. So the bone that's moving when the hamstring muscles, like the biceps femoris, the semitendinosus or semimembranosus, are contracting, the tibia is moving. So the tibia would be the insertion, and the origin would be the femur or the pelvis, the ischium. So the insertion is the movable muscle in the action. So again, all we're doing for the most part is IDing the muscle. Then you want to know the action, the origin, and insertion. Now they all need nerve supply, and you'll learn that soon too. And that's called innervation. That's the nerve supply, because a muscle can't contract without a nerve impulse. So let's say for the hamstrings, the innervation of the hamstrings to contract and flex the knee is the sciatic nerve, which you'll see is a lumbosacral nerve root. You don't know that yet, but you'll learn that. So these are important, the muscles. And for our exam, this week, you just want to ID the muscle. That's the hardest thing in some cases. Then if you want to get deeper into learning muscles later, you have to know the action, the origin, the insertion, and innervation. Like if you go to medical school, if you go to PT school, chiro school, or occupational therapy, you have to need to know these. But again, for us, we just need to know the ID or be able to identify it. On the APR pictures is what I'm going to use. The next thing I could talk about is an agonist. Like the agonist is the prime mover. Like say you're flexing your arm, you're using your biceps, like your arm flexion. Let's just say this is just an example. Arm flexion, where you're using your upper arm, bicep muscle. So the agonist is biceps brachii, and you can spell it as best as you can. Look at the list. And the antagonist is the muscle that's not contraction. It's usually not causing the movement. It's opposite. And in this case, with arm flexion, this particular movement, the antagonist would be the triceps brachii. Okay, so again, I recorded this and just to give you the list and give you some ideas of what's going on. We probably remember remember the difference between a tendon, right? A tendon. What does a tendon connect? Laverne, you with me? Anybody with me? What does a tendon connect? Bone to bone or muscle to bone?
Isn't it muscle to bone?
Yep. So I'll say bone to muscle just to confuse you, right? And ligament, that connects bone to bone. And sometimes you see this like white stuff in between, like muscles, and that's called fascia. Sometimes there's a really long name that some of these books use. It's called aponeurosis. And that's that white connective tissue. And basically, what we could say here that this connects muscle to muscle. It kind of packages it. And usually it's continuous with your tendons, the fascia. So it's the same thing. It's like that dense, regular connective tissue, and it kind of flows in between the muscle fibers and the muscle bellies. So anybody have any questions about any of that? You don't have to know the different coverings in the muscle for this lab, because again, you have enough to worry about with the identifications of the bones and muscles. So this is just good guidance, and I'll help you with your lecture.